Hello, my name is Abdi Talusma, and today I'd like to discuss a critical issue of the U.S. healthcare system, and that's access to care, but particularly for immigrants in New York City. Access to care has long been a critical issue in the entire United States for many decades, almost since the inception of the healthcare system. The issue is that certain groups of people are receiving higher quality care and at faster rates compared to other groups. These differences occur in people between different socioeconomic groups, between people of different racial and ethnic groups, and even between people of different age groups. In 2014, it was estimated that roughly 13% of the New York State population was uninsured. And unfortunately, a considerable portion of these people were actually foreigners of the uninsured. Uh, and the reason why many of these uninsured people are foreigners is because they have to jump through many more hoops and barriers to healthcare access compared to those citizens who were born here. Here we have three different bar charts that are split up according to different hospital departments. We have ambulatory, emergency department, and inpatient care. The left bar for each department represents New York City Health and Hospitals, which is a collection of hospitals that together have the highest percentage of their patient base as foreigners. And on the right of each group, we have all other hospitals. Pay attention to the blue chunk on the bottom of each bar. This represents the portion of the patient base that's uninsured. You'll notice that NYC Health Hospitals has a higher uninsurance rate for each category, especially for emergency department. We have 29% uninsured compared to 13% uninsured for New York City Health Hospitals versus all other hospitals. So why is this the case? Why is it that immigrants are facing lower access to care compared to those citizens who were born here? Well, we have socioeconomic difficulties that immigrants are facing. It's a lot more difficult for immigrants to get jobs and to get higher income. It's a lot more difficult for immigrants to get affordable housing. It's a lot more difficult for them to pay rent. They're experiencing higher rates of homelessness in some areas. They're experiencing more illiteracy rates. They're experiencing just many more different issues that prevent them from feeling comfortable and getting access to care. We have language barriers. Um, these immigrants don't have full command of the English language, and they find it difficult to ask for information. They find it difficult to voice their concerns and to voice their needs for their primary care providers. So it's difficult for them to get the ball rolling, so to speak. It's difficult for them to go to their primary care providers and say this is what they want, or ask how does this work, or in order to facilitate care. Unawareness of health policy and how the healthcare system operates. They're not provided with all the information that they need in order to understand the workings of the healthcare system. They're not provided with all the information for different insurance groups, for how different procedures work, for what the requirements are. There aren't always interpreters or translators that are available for them to help them understand all this information. What are the consequences? What are the consequences of having unequal access to care for immigrant populations specifically? Well, we have poor utilization of healthcare services. What happens a lot of the time is that immigrants will try to get care from primary care providers or from in clinics, and for whatever reason, for these barriers, they won't be able to get care in a timely fashion, and they'll head to the emergency room department, and many times they go to the ER for conditions that could have been treated in the primary care provider's office a lot earlier. They feel deterred from going to their primary care provider, and what happens is their conditions will worsen over time, and they'll head to the ER and get treated there for conditions that could have been treated in the primary care provider's office. Worse health outcomes. A lot of times they'll not be able to get screened, or they won't be able to get preventative healthcare measures because of these barriers to care. So by the time they're finally able to seek care, it's already too late, and they have to get treated in the ER. And this is all preventable, right? So it's not cost effective. Why go to the ER to get a problem treated when they could have gone to the primary care provider and got it treated earlier? And then we have a stress on the healthcare system, right? We have all these immigrants crowding the ER rooms unnecessarily, right? They didn't have to be there. If care was expedited, and if it was more efficient, then they could have been seen in primary care provider's office a lot sooner, and they wouldn't have to be such a burden on the healthcare system. And all this creates just inefficiencies overall in the healthcare system, and could be resolved if immigrants got access to care.